everyone. Zika virus has been on the radar for public health departments probably since about 2015, but we just want to refresh your memory on Zika virus with the summer months upon us and people traveling potentially out of the country. And Dr. Morgan McDonald is going to be talking to us about how you can pack for prevention, actually. Welcome to the program.
Thank you. Appreciate you having us.
Absolutely. So Zika virus, let's go back to sort of the basics. What is it and how is it spread?
Sure. So Zika virus is a virus that's similar to other infections that we've seen in the past, like dengue or chikungunya, if people have traveled to other regions. And it is spread in a couple of different ways. It's spread by mosquitoes, so affected mosquitoes in an area of local transmission. And it is also spread sexually and potentially through blood products.
And it's been primarily seen in South America, isn't that right? And several years ago we heard about it in Florida, in the Miami area. But right now they're tracking it mostly South America. And what about Tennessee? Have we had any cases?
So you're correct in that really the spread that we've been watching has been through South America, Central America, the Caribbean, certainly Puerto Rico heavily impacted. There have been some areas of local transmission recently in Florida and Texas. The cases that we have seen in Tennessee have been through travel. And so we have not had cases of mosquitoes that have been carrying this virus, but certainly we have seen people as they have returned from travel coming back with the infection.
All right, now we know that you can pack to prevent as far as, making sure that you cover yourself with the proper clothing, insect repellent. Can you go over this list that we have up on the screen?
Sure. So we certainly recommend individuals protecting themselves and their families. And the best way to do that is certainly through insect repellent. And the EPA has registered a list of insect repellents that are effective in preventing these mosquito bites. And we recommend people, yes, packing and using the insect repellent when they are on trips, but also for a couple of weeks after their return to make sure that if they have been infected, that they don't spread it to local mosquitoes. Also, certainly it's important to wear long sleeve shirts, long pants. We think about this particularly in infants, so under 2 months where bug repellent is not approved, but in those younger children and really in all individuals, covering surfaces is going to be the most effective way to prevent mosquito bites. Clothing can be treated with permethrin. Certainly recommend bed nets if you are in an area with mosquitoes or in an area that may not have air conditioning and ventilation systems. And then of course packing condoms to prevent sexual transmission for an individual or their partner.
Now what do you do if you're a pregnant woman traveling to one of these countries?
Yes, so we currently recommend that if a woman is pregnant that she not travel to an area that has ongoing Zika infection.
So don't even get in an area where you would be exposed to
That's the recommendation.
Okay, so what could happen if the woman is exposed and is bitten by a mosquito?
Sure, and two things there, both a woman and her partner that could have potential travel. And so we worry about that travel potential exposure if a woman travels or if her partner travels and comes back and could potentially expose her through sexual transmission. We also worry in that preconception period. So for a woman, if she travels to an area and is not pregnant, we recommend that she postpone pregnancy for 2 months after her return.
So that's how long it could be present in the system?
Yes, and for men it's actually longer. And so if a man travels to an area of Zika infection, we recommend postponing childbearing if possible for 6 months.
Okay. This is great information for people. I don't think people realize the length of time that they could be in trouble.
And that's a message that we're really trying to get out is to make sure that as much as possible we're planning pregnancies, and in the event that a woman could have been exposed either prenatally or during pregnancy, that she go and request a test.
Okay, what are the symptoms of Zika?
So Zika infection is interesting because it's not, it's frequently asymptomatic, often doesn't have symptoms. If there are symptoms, it's things like cough, fever, rash, and muscle aches. So
and joint pain.
I'm sorry,
as
I had
well?
mentioned cough. It's not. It's really not cough. It's fever, joint pain, rash, and
red eyes. Okay, so those would all be. But then some people may be without symptoms. Is that correct?
Yes, frequently without symptoms.
So what would you treat someone with if they do develop this? What would they be treated with?
Yeah, so there's not a specific treatment targeted at Zika virus. This is really symptomatic care. Often these symptoms are very mild, and so treatment with Tylenol if there's a fever present, rest, fluids. We recommend if someone has traveled and there could be a potential of dengue fever, and particularly not to use anti-inflammatories like Advil or Aleve, but really to stick with the Tylenol.
Now, if a baby is born with Zika, we've seen some of the heartbreaking pictures of some of these babies. What can be done to help these children?
Yes, so there are protocols that if a woman is diagnosed prenatally with a Zika possible or confirmed Zika infection, there are protocols for following that woman through pregnancy that include serial ultrasounds and counseling for the woman and her family. We also here in the state of Tennessee monitor those pregnancies and outcomes and reach out to the families, connect them to specialists if that is needed. We connect them to early intervention systems within Department of Education. We know that early access to physical therapy, speech therapy do improve outcomes in the long run. And then we connect families to family navigators that help them really think through opportunities for their children as they grow with this.
Okay, thank you so much, Dr. McDonald. You gave us a lot of very valuable information about Zika and something we all need to be aware of for traveling or know people traveling. To stay safe. Thank you so much for your time.
Really appreciate it.
All right, and we'll be back with more after this.